I feel like social prescribing is doing something for yourself. Being empowered to know that there is another route than the medicative route. Allowing yourself to understand you and that there is someone who's there to speak with, listen to, and explore avenues that you might be missing.
Social prescribing has changed my life. They look at you as a whole person. They're willing to listen and make recommendations that may have been successful for other people, and they ask you, how can I help you? So you take the lead, as in, you're saying this is what I need.
My background is that my father was a Romani, my mum was an Irish traveller, and I was the first person in my family to be born and raised in an urban environment. My initial diagnosis was for PTSD, which is post-traumatic stress disorder, and suicidal ideation. I was isolated indoors, I couldn't go out, and I wasn't speaking to anybody. So the social prescriber would ring me every week and just check how I was. It was about 4 months before I was able to go outside my front door. So it was a long process in talking to me, trying to get me to open up, trying to gain some confidence, really.
I had a fibroid operation and then I had an infection. I was scared in hospital with everything that was going on. And then I was at times scared at home. Part of the problem was being alone, and Sophie just was like my accountability buddy. She just kept me in check. She'd ring me, I think it was every 2 or 3 weeks.
Through having different outlets, I don't mind getting up. I've joined art groups where we do a variety of things, mosaics, textile pictures. From that as well, they set up a chronic pain group, so we kind of all keep in touch with each other.
I'm so happy I'm now attending the course. I'm learning loads, and I feel like when we're all in that space, there's no judgment there.
For me, it was about introducing me to other networks or activities where you can connect with like-minded people, where you can support each other. She signposted me to talking therapists. First time in my life, at 58, I was actually talking to therapists. That was amazing. I think I'd been that support mechanism to many people, but I'd never had that for myself.
I'd done a course on mindfulness, and there was a course on strategies to cope. We came upon the listening place where you go and they listen to what you've got to say about how you're feeling. It's one of the sort of key things I think that have kept me going.
Sophie was my lifeline, literally, because she's been able to move some of the things on my list forwards, and she set me on a really good path, and I don't feel so alone.
Okay, so I've got this and I've got this, but I can still do this. Then that's got to be a bonus. I wish somebody had been there for me 20 years ago. Something that you're doing to make yourself feel a little bit worthy.
I am an advocate for wellbeing, and this opportunity wouldn't have been afforded had I not connected with Social Prescriber. If you need help and support, don't be afraid to ask, because people are there to help you. The Social Prescriber has many tools in their toolbox that can help you.
If you need to access the services, go and access them, because we all need help, all of us at some time in our life.